Good afternoon, everybody. Celine Galgett here, clinical psychologist from Melbourne Wellbeing Group. Today, I'm going to spend a little bit of time demystifying the mental health care plan. Now, this definitely warrants a video because you can ring Medicare 10 times and get 10 different answers as to what the mental health care plan is all about. And us clinicians still get confused by it, but I'm going to try and explain it as best as I can, because when you, as a consumer of a mental health service, need support, and you need to know what to ask for when you go to see your GP, for Medicare rebates if you're eligible for them. So the mental health care plan is basically a care plan that's set up through your GP. So in order to access one, you'll need to, when you give your GP clinic a call, you'll need to book a double appointment. They'll request that you spend at least half an hour with them to obtain a mental health care plan. So when you go in to see your GP, they might recommend a psychologist for you, but you might have the name of a psychologist that you want to see, and when you go and speak with them, you can say, I'd like to see such and such a person because I feel like I'm struggling with A, B, and C. They'll ask you some questions. They'll work with you to fill in the care plan, and they'll give you that mental health care plan and a referral. So the care plan is different to a referral. The referral is just it's a referral letter, and usually the mental health care plan is attached to that referral letter. So they'll give you two of these things to then take with you to your first appointment with the psychologist that you have chosen to see, or who your GP has recommended for you to see. And when you take that with you to the psychologist, that mental health care plan is valid for 12 months from the date that it was written. Okay, so keep that in your mind, because this is where it gets a little bit confusing. So the mental health care plan enables you to obtain a rebate for your psychology session from Medicare, but it is limited to 10 sessions, but it's 10 sessions in a calendar year. So if your mental health care plan was written today, the 10th of July, then the care plan is valid until the 10th of July next year, 2019, right? But you've only got 10 sessions in a calendar year. So you've got between today and the 31st of December this year to use all 10 of your sessions. So when the 1st of January clocks over, that care plan will enable you to access a new lot of 10 sessions. But come July, you'll need a new referral and care plan. I really hope that makes sense. The mental health care plan will enable you to obtain a rebate for your session from Medicare. So generally speaking, the way that it works at our clinic is that when you come in for the session, you pay for the session, and then we then submit a claim to Medicare on your behalf. So you don't have to go to Medicare. So if you've got your care plan in place and you bring your Medicare card along with you, we punch all of those details into our computer system. And then what we do is we then, after you've paid for your session and you've had your session, we then tell Medicare that you've come to see us, and we tell them who you saw, and then Medicare will give you a rebate, and they will put that rebate back into the bank account that you've got saved with Medicare. So it's all done online. So off the top of my head, I think it was last year sometime, Medicare stopped giving out checks. They encouraged everyone to save a bank account with them, so that whenever you go to a health professional of any sort and you claim a Medicare rebate, the refund or the rebate that they will give you goes into that nominated account that you have nominated with them. And so when you come and see us, we take away the stress of having to go to Medicare for you. So after everything's settled, we then let Medicare know you've come to see us, and then they then usually overnight, but if it's an after hours appointment, it's usually the following business day that they process the claim. They then rebate you the rebate amount into your bank account. So it's nice and easy. Once it's all set up, it's easy, but it's then knowing what to do in order to get that mental health care plan and how long it's valid for, that can get a little bit confusing. So generally speaking, people who get a mental health care plan in the middle of the year, towards the end of the year, are able to get continuous care because it clocks over on the 1st of January, so it makes it a little bit easier. Whereas people who get care at the start of the year usually have to space out their sessions a little bit more, and that makes it a little bit trickier. So that's that part of the care plan. The other part of the care plan is after you've seen your psychologist for the first time, the psychologist will generally send a letter to your GP to say, hey, thanks for the referral. I've met with your patient. This is what we discussed, and this is where we're expecting to go. And then what will happen is, after you've had 6 sessions with your psychologist, you will then be due to go back to the GP for what's called a review session. And your psychologist will generally clue you up with this. And so basically it's then up to you to head off to the GP, have a review session so that you can access the extra 4 sessions that you're eligible for. And what will happen is at that time, your psychologist will also write a review letter to the GP to just give them an update as to, and very generally, what was covered, and where and what the treatment recommendations are, or the ongoing treatment recommendations. And then when you see the GP, they'll discuss that with you. They'll give you a letter to give you access to the extra 4 sessions. You bring that back with you to your 7th psychology appointment in order to be able to get the rebate for session 7, 8, 9, and 10. Okay, so that's the mental health care plan. The additional thing that people can now access is called the chronic disease management plan. This is slightly different, but what it does is, if you are eligible for the chronic disease management plan, it's usually for people who have 2 specialists looking after their care that is required for their diagnosis. We work a lot with people who see a psychologist, us, as well as a psychiatrist, in order to treat their mental health condition. And so this is part of a care team, and we would be considered, aside from a GP, 2 specialists who are looking after someone's care. And so what that does is it enables, if this is your situation, then it would enable you to access the chronic disease management plan, and that enables you to access a further 5 sessions with a Medicare rebate. The rebate is not as big as what you would get under a mental health care plan, but it's better than nothing, and it gives you those extra handful of sessions to keep you going. The added bonus of all of that is that once you've used all of your Medicare, and if you have private health insurance, depending on your level of cover, it's different for every health fund, you are then able to use your private health insurance to also get a bit of a rebate to cover some of your psychology sessions. So we have high caps at our clinic, so that means that we can help process the rebate with your private health fund most of the time. If your health fund likes our machine, it's a bit temperamental, and what that does is your health fund will pay a certain amount, and then the gap is left for you to pay. So it works a little bit different. The reason why Medicare doesn't work on a gap basis, the reason why Medicare wants you to pay for your session in full first and they give you a rebate, is because they want to measure how much people are spending on healthcare, and they want to know, and they want people who are consuming health services to reach their safety net a lot quicker. So there's this thing called the Medicare safety net, and that basically means it's a threshold of how much money you're spending on health services every year as a family, or as whoever's on your card. If it's just you on your card, then it's just you. But if you've got 5, 3, 4, 5, 6, 7 people on your card, then it's all of you all together. How much whoever's on the card is using in terms of healthcare. And once you reach that threshold, the rebate that you get is a lot higher. And then there are several thresholds that you can reach. And from the top of my head, by the time families have reached the highest threshold at our clinic, then once they've paid for their session and received the Medicare rebate, then they only end up being, I think, like not even $10 out of pocket. So you basically want Medicare to work the way that it does, because it means that once you have a total in terms of reaching your Medicare safety net, once you do that, then the better it is for you. So that's just a little bit about the safety net and how Medicare works, and why they don't pay a gap, why they don't want you to pay a gap, why they want you to pay the full amount. It's really for your benefit, so that you can reach that safety net. It makes it confusing because private health funds work a little bit differently, whereas they pay the amount for you and then the gap is left for you to pay. So that's really that difference, and I hope I've got this right. And oops, there we go. My battery's low, so it went into power saving mode before. So I hope I've got it right. If I haven't, please let me know. But that's generally the gist. So we'll see how that all pans out. But I hope you found that really informative in terms of demystifying the whole mental health care plan process versus rebates versus private health funding and all the other stuff in terms of what it requires when seeing a psychologist. The other thing I forgot to mention was when you get to 10 sessions, your psychologist will write a letter back to the GP to say that all 10 sessions under Medicare have been utilised, and will either recommend or talk to you about the chronic disease management plan, or they will at our clinic, or they will talk to you about accessing private health, and that will also be put down in the treatment recommendations for your GP. Or if you've allocated to pay for your sessions out of pocket, then that will be documented as well for you in order for your care to continue if you need extra support in achieving the outcomes that you want to achieve. So thank you for watching and listening, and I hope you found that really useful. If you have any questions about any of this process, please drop them in the comments below. We'll do our best to answer them. But if you have any questions about any of this, or you've got an upcoming appointment with one of our clinicians, or you're feeling a bit confused by it all, please don't hesitate to give our admin team a call. Our phone number, we're in Melbourne, our phone number is 039882 8874. Thank you for your time, and I'll catch you next time. Bye for now.